It now gives me pleasure to introduce Dr. Jordana Peake, Senior Evaluation Officer for the Hertfordshire Year of Culture 2020.
Hi, thank you so much. Thank you. So today I'll be talking to you all about the impact of arts and cultural activities carried out as part of Hertfordshire's Year of Culture on an individual's well-being, looking specifically at individuals who are lonely or socially isolated. So I'll start by giving you a bit of background to why we did the evaluation, go over some key aims and objectives and our evaluation approach, and then detail some methods that we use to collect and analyse the data. And then I'll just go through some preliminary findings. So these are just preliminary findings. I'm still collecting some data and data analysis is still underway. So this model here is it's a dynamic model for wellbeing by Campion and Nurse, and what it really accentuates is the really complex nature of wellbeing. And sort of looking in it's a very busy diagram, there's lots going on. Looking in the middle, the definition of wellbeing, so to be at ease with oneself, to have meaning and fulfillment, to have positive emotions and resilience, and to belong to a respectful community. And the model accounts for both personal and social risk factors for well-being, and it accentuates the interaction between physical, social and mental health and well-being. And the authors, they state that so intentional activities and those that are actively that you actively take part in account for about 40% of happiness. And these such activities include leisure activities, socialising and arts and culture. So in 2008, the Neuroeconomics Foundation came up with 5 evidence-based actions that we can do to improve our well-being. So these are all listed here. To connect with the world around us, to be active, to exercise, take up a new exercise that's appropriate for us, to take notice, to keep learning, to take up a new skill, to give our time to do something nice for someone else. But these 5 actions are mainly based on research with adults. So the Neuroeconomics Foundation, the Children's Society, did a study with children looking at activities that lead to increased personal well-being for them. And these are listed here. And as you can see, they're very similar to the 5 ways to well-being. But for children, so the activities they said were, led to, greatest increases in well-being were being aware of one's surroundings, enjoying one's surroundings, teaching yourself something new, talking with your family about things that are important to you, and reading for pleasure. And very, very interesting was that in focus group discussions, completely unprompted, children spoke about the benefits for them of play, of creativity, such as art and dance and music, and also imagination. So in I think it was 2005 or 2004, a review was done by Sterakov of the impacts of art in healthcare. And this was really interesting and showed many beneficial effects. So many of the studies were focused on music, with a few looking at visual arts. And for example, there was shown to be a reduction in depression and anxiety in those undergoing cancer care. And then there was an update of the review in 2011 that focused just on music, and that found further robust evidence of benefits of the arts in healthcare. One key area was improved behavioural and clinical outcomes in children. And there's also been suggestions of benefits of the arts for those accessing mental health services. However, as argued by Dakin and Bine, very few studies actually look at the impact of arts on mental health, and they don't look at art processes. So actually, how are these art activities having an impact? Oh, whoopsie. Just a few definitions. So social prescribing, so that's often used when referring to GP, and it just basically means that, you know, if you go to your GP and you say for something such as, say, you're lonely, it's not automatically assumed, oh, you know, you need to have drug therapy or go for counselling, that other activities, social activities in the community are also considered. And then arts on prescription, that just looks specifically on arts activities, so people being, you know, referred to arts activities. And there's been a real surge of community-based arts and health initiatives in recent years, and this is largely due to arts on prescription programs. However, looking at loneliness, and this was a review of reviews that was done in 2018, what was found is that actually the evidence still isn't very strong of the impact of arts on loneliness, and we all know that one of the biggest challenges to well-being is loneliness. And specifically, it isn't very clear that taking part in arts activities has any benefits above, say, volunteering or befriending schemes. And also many of the studies are focused on the older population, and the term loneliness is often poorly defined. And so, you know, obviously it has to be said in terms of the context in which this evaluation was carried out. And I mean, all these events are in the library, imprinting all our memory. It's been an incredibly difficult year. So, I mean, we had our first lockdown in March, then there was a little bit of light, you know, in May when the lockdown ended, and still socially distanced measures in place, but we were able to have a little bit of a summer. Things opened up a bit, and in the autumn, things sort of progressively went downhill again, with us entering the tier system, then going into another national lockdown in November, going into a stricter tier system in December with things not looking very good over Christmas, and then again back into another national lockdown in January. So it's been a very challenging year, and for, you know, in terms of the year of culture, what activities it was possible to carry out, so many have had to go online. And also, I mean, for all of us, social isolation, we've all been socially isolated to a certain extent. Thinking about that context, in terms of what we wanted to focus on with the evaluation, was looking at so art activities, both those carried out online and face-to-face, how they impact on an individual's well-being, but specifically looking at those who are lonely or socially isolated because of the year that it's been carried out in, and also, you know, feeding into the idea of this importance of social prescribing. And so some key objectives were, you know, obviously initially asked, does taking part in these activities lead to improvements in well-being? Does taking part in these activities lead to a reduction in isolation and loneliness? But then thinking about more secondary objectives, which are secondary, so-called secondary, but actually they're no less important, thinking about the how are these art activities having an impact? And looking at this sort of model here, which is very much a sort of a prototype because it hasn't been widely tested, but it's just this concept that you've got these active ingredients or critical components of an arts activity that, you know, lead to these changes, these differences that you see, and differences in well-being, differences in loneliness. So trying to explore, you know, what are these critical components and how are they having an effect? So in terms of data, so we wanted to, you know, obviously look at some measures for well-being and loneliness, so before and after activities where possible, so, you know, via a survey, and then to ask some, you know, more open-ended questions with the survey, and then to also have a more in-depth method to understand how these activities are having an effect, so through focus groups and semi-structured interviews. So then, you know, the plan to compare these two data sources, the quantitative and the qualitative, and then to come to some conclusions. So looking at wellbeing measures, so the national personal wellbeing measures. This asks, so it's 4 questions about wellbeing, and it asks you to give a rating from 0 to 10. So the 4 questions are here. So the first is about life satisfaction. The second is how worthwhile you think your life is. Happiness is the third one. And the fourth, the scale is flipped. So looking at anxiety, where you rate 0 if you're not anxious at all, and then 10 if you feel completely anxious. And looking at loneliness, so using the ONS, so this is based on the UCLA 3-item loneliness scale, plus a direct question about loneliness. So these questions are here. How often do you feel you lack companionship? How often do you feel left out? How often do you feel isolated from others? And how often do you feel lonely? So important to make the distinction between isolation and loneliness, which are often used interchangeably, and they're not the same thing. And sorry, yeah, so this word, every time I write it, I have to look it up. It's a real mouthful. Interpretative phenomenological analysis, which just basically means looking at how people make sense of their personal and social world. So this is looking at the interviews of focus groups, which get much more in depth, trying to talk to them, about the meanings, what certain things mean to them, what experiences mean to them, what taking part in these activities means to them. So it's a really good method, actually, because it really goes really deep, and what you get out of it is quite interesting. And just to mention very quickly about ethics and consent, so ethical approval was obtained for the evaluation because we are working with vulnerable groups. Everyone who completed a survey, they had a privacy notice at the beginning telling them what would happen with their data, and everyone received an information sheet before taking part, which detailed what the evaluation would involve, and that they're under absolutely no obligation to take part. And they can, taking part is completely voluntary, and they can withdraw at any time. And consent was obtained before every interview or focus group, whether that was written or verbal. And so these are the 8 wonderful organisations that have taken part in the evaluation. That have been absolutely amazing. Listing the organisation, the type of activity, the population group, number of participants, and time scale. So the first 3 in blue, they were all online activities. The next 2, the ones in red, they were face-to-face, and the final 3, they were blended. So they were mainly face-to-face, but parts had to go online because of lockdown. And I'll just be focusing on these first 4 today, just because of I've still got interviews and focus groups to carry out with children. The data in many cases collected slightly differently because of the population groups, but all data, all findings will be included in the report at the end of April. So looking at these wellbeing scores, so looking at the first 3 questions, looking at before, so baseline and follow up. So after they've done the activity, there isn't a huge variability between the 2 for each of these questions. There's a few dips between before and after, and some increases, but yeah, generally quite similar. Then you look at anxiety, and it's all over the shop. So if someone's gone from having not being anxious at all to going up to 5 on the scale, and then someone's gone from going from 7 to 0, and someone's gone from 1 to 9. So some real drastic changes. And then just briefly, for some of the participants, we asked, how satisfied with your life do you feel now compared with how you felt before COVID? Again, a bit of change, but nothing too crazy. And thinking about those changes and thinking about those anxiety scores, and actually looking at the time scale at which these evaluations being carried out. And you could look at that and think, oh my goodness, it's showing that these art activities aren't having any impact. You can't say that at all. I mean, the time that we were living in, it's no surprise that the anxiety are going up, they're going down. I mean, it's been awful for all of us. And it's that time, from October going towards Christmas that many of these activities were being carried out and things were getting progressively worse, and it was scary. So it's not really a surprise. And thinking about loneliness, so looking at the measures in the survey, it wasn't any huge differences before and after, so I haven't included them here. But what was really interesting, I had a free text box in the survey after each of the loneliness questions where they could just write what they wanted, and that was what was really interesting. And people spoke about the constraints of the pandemic, the impact it's had on their social life, really, the need to stay in contact, and the importance of online and telephone, how important it was to have someone that they were living with, and the real difficulty of having a recent bereavement. So so the focus group, so now looking at going more into the qualitative data, looking at the interviews and the focus group. So the Connecting Conversations group were amazing. So we had a focus group with them in the summer, and they really helped to develop and inform the evaluation. And we asked them, what do the terms art and culture mean to you? And they said that art and culture, it's who we are. It's who we are. And they spoke about music and how it's like a natural language. You can express yourself without words. And it was seen as this place where you feel relaxed. It's the enjoyment which often gets overlooked, and that sense of distraction at such a difficult time, it sort of takes you away. And then thinking about the interviews with the adults who actually carried out the art activities, like the counsellor was saying right at the beginning, exactly the same. The people said art has been like a lifeline during the pandemic. They spoke about the importance of gaining new skill at such a difficult time, having this sense of purpose, adding meaning to their life through having taken part in these activities, the importance of routine and structure, having this thing to look forward to, and a sense that we'll feel the same, and you come together with individuals, and just being with other individuals, whether it's online or some of them were still able to go ahead face to face at a distance, you still, you're all in the same boat. So even that you feel supported because you're all in it together. So just knowing you're not alone in how you're feeling, I think makes such a difference to people. And again, doing what you enjoy, what you love, just it makes you forget about everything else. So here is a nice tree. It's not I stole it from online, but there's the acknowledgement of the source, and anything additional is just things that I've added. They said to specify that. But yeah, trying to build up a bit of a model. So this is only based on really in-depth evaluation of a few interviews and focus groups, and then looking at patterns in other ones that have been carried out, but the in-depth analysis hasn't been carried out yet. So this is just starting to build up a model. So it's a sort of preliminary model, thinking how are these art activities impacting on well-being, and this sense of freedom of expression. So someone spoke about how with other activities you take part in, you just, you work to a specified cause, but with these art activities, you always go beyond, you always go further. And linked to that is this sense of improvisation. Someone said about how we start with the dance movements already inside of us, this sense that, there's no right or wrong. It's sort of that so freeing. Sense of absorption, so getting lost in what you're doing, you forget time, you forget what else is going on around you. Again, so many people spoke about music and the importance of that sort of emotional connection. Being a safe space, so teachers were very important in terms of promoting this, and people just couldn't praise the teaching highly enough. It was just amazing the way that the teachers made them feel, even if they were online, they're not actually physically in the same space, but their consideration for individuals, ensuring they have the right things that they need, they take lots of rests, and it was quite amazing. And also the physical space as well. So the Connecting Conversations group said, we spoke to them in the summer, and they've all got lived experience of loneliness. They said they weren't ready to go out yet and start taking part in face-to-face activities, and someone described Zoom as a step away from loneliness. So they were still able to connect, but they didn't have to actually go out yet. So that sense that even though, you know, we think of the online as, you know, it's not that great, but actually sometimes it's not the inferior to the face-to-face. Sometimes it's the most appropriate way to deliver things. Sense of creating with others. You're not on your own. You're creating things together, working as a team. That sort of togetherness of these activities, and the importance of them being fun. And again, the teachers were so important for this, and they were all praised so highly that, you know, they made it so enjoyable and fun that you just really look forward to it. So the fruit that these things bear, that you get a sense of achievement, increased confidence for doing something you thought that you couldn't do. You feel supported through the friendships you make, the connections you make, and you experience enjoyment that goes beyond the class. You carry on dancing, you carry on practicing the art. It's quite amazing. And how it leads to an improvement in social, emotional, and psychological well-being. And I thought this was very interesting. This is what one participant said: the physical well-being of movement in your body, mind and heart. And it's that connection between the physical and the psychological. They're not separate. And that sense of the movement affects you physically, psychologically, but also sort of emotionally as well. So in terms of further work, so still got some interviews and focus group discussions to carry out of children and teenagers. And just to say again, so the Connecting Conversations group has really informed the evaluation a lot, but also the nurture group tutors, we've spoken lots to them, had a few focus groups with them, and they've been great in terms of adapting methods for children and you know, going over topic guides, etc. To complete the analysis, so I still need to complete the analysis, and the report will be written by the end of April 2021, and the findings will be ready to be disseminated. So this slide, I'm sure that I've missed somebody. I'm so sorry. I mean, there's been so many people that have, you know, been part of this, and just such a pleasure to work with everybody. And, you know, the last but definitely not least, is all the wonderful people who, you know, completed the surveys, had chatted to me over the phone or over Teams. I think we did one face-to-face one back in October with our masks on. That was really nice on focus group, but yeah, I've mainly been remote. And I'm very happy to take any questions that you have. If you want to pop them in the chat, then I've gone over.
Thank you, Jordana. That's fabulous. Thank you so much. We have just got one quick question. I know we're running a little bit over time, but what were the age range of the children and young people who were interviewed as part of the research? That's from Samantha at Watford Palace.
So we haven't interviewed any children yet, so they're next. So the nurture groups, we were meant to interview them, to have a focus group with them just before, well, in January, right over after Christmas, and then the schools didn't open. So we'll be having a focus group with them at some point this month, and I've got some interviews to carry out with some teenagers from the Dantien. So in terms of the range of ages, so it would be primary school age children, that I speak to some primary school age children and some teenagers as well. Yeah.
Brilliant. Thank you. There's a few other answers to the questions have gone in the chat as well, so which is a really useful thing to have. So thank you so much, Jordana.